everything. Do you guys want to just kind of relate to me what you've been seeing?
Well, she caught him a little bit ago trying to pee just on a pair of shorts on the floor, which she's never not gone outside the litter box.
Gotcha.
And after that, we kind of realized he hasn't been eating that well lately. And when we picked him up to kind of check him out, as she was reaching in there, it started leaking everywhere as she squeezed.
Gotcha.
Yeah, his bladder was like the size of an orange.
Okay, gotcha. And he was able to kind of express some out of his bladder?
It dribbled out, yeah.
Dribbled out, okay. And how long has he been kind of acting off for, it sounds like?
In retrospect, a day and a half.
Okay. Okay. And how many times have you seen him kind of go to the litter box and strain?
Twice. I've seen him get out and still be in the hump up position, and I was like, something's wrong.
Yeah.
And then he would go straight to his little cat tree and hide.
Okay. Okay. And he urinated on your clothes, you said, right?
He attempted
He tried.
Okay.
We, stopped him from it.
Okay.
But now I kind of wish we hadn't.
Okay. And how has his appetite been?
Not well.
Not great. Okay. Has he been eating a little bit or none?
A little.
Okay.
Not enough that we noticed that he's starving himself.
Okay. And that's been happening for about a day and a half?
Yeah.
Okay. And have you noticed that he's been vocalizing in the litter box at all, or going more frequently?
I haven't really noticed anything. He's he's still basically a kid. I mean, he's a year old. He's normally very energetic and playful, and he's just been kind of lethargic the last day.
Okay.
No, he's normally crazy.
Gotcha. Okay. And is he an indoor only, or does he go outside?
Indoor only.
Indoor only. Okay. And do you have any other cats in your household?
Mini.
6.
6 cats. Wow, that's awesome.
6 others.
Gotcha.
And because of that and a couple of electric litter boxes, it's hard to monitor and see who's doing what when.
Gotcha. Okay. Okay. And were there any new introductions of cats recently, or any changes in the household?
Recently changing the diet.
Okay. And how recent was that?
Month.
Okay. And what did you change it from and to?
They were on Nulu, and now they're on something called Open Farms.
Okay.
With new lower like canned food mixed in, dropping it.
Gotcha. Okay. So they're on half can, half dry.
Yeah.
Yeah. Okay.
They always get wet.
Okay. Awesome. Okay. And does he have any prior medical history? I know he's only 1 year old.
Just that random lump on his head that everybody told us is fine.
Okay. Okay. And is he on any medications right now?
No.
Okay. And I'm assuming he's up to date on his vaccines?
Yes.
Okay.
No.
No.
He hasn't had vaccines since he was a kitten.
We're bad at that.
If you guys want to do them while we're here.
Unfortunately, because we're an emergency
No,
clinic,
it's
we don't
not.
have them. Yeah. Okay. So last time you got it was when he was a kitten?
Yeah.
Did he get his series?
boosters.
Okay.
We adopted him from a no-kill cat shelter, so they took care of the whole
series?
Yeah.
Okay. Okay.
That's why we fostered with him and then couldn't give him back.
Of course. I fostered a cat recently and was able to give the cat back, and I was very proud of myself, but I was expecting myself to keep the cat too.
Congratulations.
So,
It's
yeah,
very hard to
it's
do.
really hard.
I said no more than 2 and we're up to 7, so we stopped fostering.
That's probably a good call.
I have a cute little dwarf cat though that we got from fostering, and her name is Winky.
Oh, cute. Awesome. Well, so I'm going to grab a pen really quick so I can write on the whiteboard while I talk to you guys about what I think is going on.
Okay.
Okay. So right now, Ingo, so when I palpate his bladder, like you notice, his bladder is huge and it's really hard. Yeah, and typically when owners are able to palpate it, that means that it's very distended and full. And when we see that in combinations of signs of, straining in the litter box, maybe producing a few drops but not actually producing any full streams, we get concerned of what we call urinary obstruction, which is pretty much where our bladder, communicates with the outside world, right? And there's an obstruction or a blockage somewhere kind of in the urethra, which is the tube that goes to the outside world. So it could be in here, it could be up here, it could be down here, we don't know for sure. But what really is happening is the urine isn't able to flow out, so the bladder gets extremely big and hard and results results in quite a few different changes because, of course, we're not able to get rid of our urine. So unfortunately, this is what we consider an emergency because of the things that can happen secondary to when they have this urethral obstruction. And what the main things that concern us about these obstructions is, first of all, electrolyte changes that can go along with these obstructions. So really what the urine contains is a lot of potassium and a few other electrolytes. And when we're not able to void that from our bladder, it actually causes our levels in our bodies to rise, and that can cause issues with our heart because that electrolyte is really important for heart function in general. And then on top of that as well too, of course, our bladder is connected to our two little kidneys. Don't mind my terrible drawing, but our two little kidneys, and if we have issues with moving fluid through our kidneys can get affected as well too. So it becomes kind of an emergency because of the urine not being able to move through. It is common for us to be able to see that they dripped a few drops of urine at home, but by the time they come here, we're not able to express them at all, which is the case. I can't express any urine from his bladder right now, so I think he is fully obstructed. So really what causes this, are you guys familiar with these obstructions at all?
I've known that male cats can have problems with crystals. We have 2 other male cats, but we've never had a problem.
Gotcha.
So that's why I was like, bring him over here and let me feel his bladder.
Yeah.
When I felt how huge it was, I was like, yeah, this is probably an emergency.
Yeah, you're right. You're absolutely right. So typically what we call this is feline lower urinary tract disease, or FLUTD. So FLUTD, what really happens is it's just an underlying disease that cats get for a huge list of reasons as to cause kind of abnormal urination habits. So sometimes it can be due to, like you said, crystals. Sometimes it can be due to just abnormal amounts of blood in their urine. Sometimes it can be due to stones in their urine. And there's kind of a whole list of things that can cause this. It actually can even be due to mucus plugs in the urine as well too. But really the factors that contribute to this, and what we've been able to figure out so far with research, is that the most predisposing factors are stressors in the household, and also changes to their normal daily routine and lack of intake of water. So really we're trying to keep them fully hydrated and reduce stress for them to not have these issues again.
How long would it take stress to affect it?
Sometimes it can be immediately, and sometimes it can take days.
Well, we just moved from Montana a month and a half, 2 months ago.
Okay.
So is that too long?
It's possible it could have caused it. So he might have been kind of developing the inflammation associated with this disease. So he could have had abnormal urination habits where he's still actually able to void his urine, and then over time it caused that blockage. So it is very possible that potentially could be causing.
We also just had guests.
Yeah, guests are, stressors. Cats are hard. Cats get stressed by anything. I have had cats that block when the mailman rings the doorbell and things like that. So it's hard for us to really know exactly what's causing this, but ultimately we know that there's a lot of different stressors that can. So ultimately with this feline lower urinary tract disease, so like I said, we can kind of have this obstructive form, so where they actually are blocked, which is the case for your kid today. But we also can have the non-obstructive form, where they pretty much get abnormal urinary signs where they're straining to urinate, they seem to be going to the litter box frequently, but they still are able to void their urine. And really once they get this in the first place, they're predisposed to getting it again. So ultimately, we're at the obstructive part today, which definitely, warrants some pretty aggressive treatment to kind of get him out of this cycle. But I do want you guys to understand that this is kind of an underlying disease that he can experience in the future as well too. So if we hospitalize him today and do everything, which I will talk to you guys about in a second, there's definitely a possibility that he could, first of all, obstruct in the future, or second of all, kind of have this non-obstructive form where he has urinary issues, but isn't actually obstructed, but could be predisposed to doing that in the future. So it's not something we can just cure today, unfortunately. It's kind of like an underlying disease process that cats get predisposed to. Does that all make sense so far?
Mm-hmm.
Okay. So as far as today with the obstruction goes, so really what we need to do in terms of relieving this obstruction is, of course, we need to pass a urinary catheter, and we need to pretty much remove that blockage that's causing them to obstruct. And really what we're doing is we're, putting them under some pretty heavy pain meds and sedation to do so, because of course we can't do that while they're waking up. And we're trying to unblock this, the bladder itself. I will say risks associated with that. Of course, we're passing a little tube into the urethra, which potentially has a blockage. So there's a possibility we can potentially tear the urethra. I will say it's quite low, but it does happen, especially with these blocked cats. So it's something I want to prepare you guys for as an option. And then on top of that, of course, we have the risks of anesthesia as well too, or sedation, which in combination with electrolyte abnormalities can cause kind of some issues in terms of keeping them under, sedation. So of course we use a protocol that's as safe as possible, but it's not a completely risk-free procedure by any means. So really what we do is we go in and we remove that obstruction and we put a urinary catheter in, and we keep the urinary catheter in typically for about 2 days to pretty much help flush the bladder out, kind of get them really hydrated in the hospital with fluids, and try to get their kidneys happy and also their bladder happy again before we remove that catheter itself.
So will he be here for a couple of days?
Typically it's about 48 hours, yes.
Okay.
And sometimes it can go a little bit longer depending on how they're doing, and sometimes it's a little bit less, but typically 48 hours is our, happy spot of what we recommend doing.
Poor guy.
Yeah, and ultimately what we're doing is we're giving them a lot of fluids to pretty much help support their, body, and then also they have a thing called what we call post-obstructive diuresis, where after they're blocked, their body's like, wow, we can urinate now, and they try to urinate as much as physically possible. So they're losing a lot of fluids, so we're giving them a lot of fluids to kind of help make up for that system or that process in general as well too. And of course, as they're in the hospital, we're monitoring their kidney values and we're monitoring their electrolytes to make sure that they're in a good place, to make sure that they're healthy, of course, and good to go home after that. I will say most cats do well with this, but again, it's kind of this long-term conversation I always want to have with owners where, even if we get him through hospitalization today, I can't guarantee that he doesn't block within the next week or two, or maybe year, or never again. It's hard for us to predict. So it's a possibility he could go through this a second time, and it's something that I just have to prepare owners for in general, is the possibility of it happening. Does that all make sense? Do you guys have any questions for me?
Do you have scratch pay?
Do I have what?
Scratch pay.
We take a care credit, which is a credit card that you guys can apply for. It's like a medical credit card, and then they do monthly payments as well too, and you can apply for that online if you're interested. Just so you guys have a kind of a general understanding of the price for hospitalizing and doing the unblocking and diagnostics and everything, we're looking around $2,800 to $3,800 for the 42 hours 42 hours or so.
Okay.
And I will say, of course, this is a very, big financial, strain on anybody. And I will say, again, it's possible that we could discharge him in 48 hours and he does well at home for a few days and then potentially can reblock a second time as well, too. In the scenarios where they do have recurrent blocking, so they block more than once, or even sometimes in the beginning, we offer a surgery where we're pretty much rerouting their urethra to prevent or really reduce the chance of them blocking in the future as well, too. We call that a PU surgery. And that's also an option as well too. I just want to have, all of the options on the table for you guys of what we can do going forward. But if you guys would like to apply for care credit, you can. I
We
will.
won't get approved, I can tell you that right now.
Okay.
We have fans.
How much of that needs to be up front, or does it all have to be paid up
The
front?
28 needs to be up front as our the down payment, and then we'll collect the remainder of the payment after the hospitalization itself. So unfortunately, most of it's taken at time of service.
Awesome.
It'll be fine.
Do you guys want me to give you a second to talk?
I need to take a picture of that and post it.
We have an online fan community that's donating to them.
Oh, okay.
Since we drove here, we've got about 700, but obviously not nearly enough.
Yeah. You want me to give you guys a second
If
to
you
kind of
could,
figure some
that'd be
things out? Okay, sounds good. I'll have somebody come check in you in about 5 or 10 minutes.
Thank you.
Okay, thank you.
There's no way in hell we're gonna raise that much for Rigo.
If we don't put him on block, we'll have to put him down.
I know. But there's no, how are we gonna get another $2,000